let me. So anyway, Traeger. I don't know if anybody is familiar with the word. It has been taught to us, or actually not really taught, but demonstrated in my school when I was in massage school, and that was 21, 22 years ago. And it was weird to me. Traeger look really weird, but as I went on and on with my massages in the 21 years I've been doing this, almost 22 years now, I actually started using it a little bit more and more as an assessment tool. I did not go to school for Traeger, but I do use it once in a while in my massages as a beginning and ending of my massage.
The Traeger approach is a form of somatic education. Proponents claim the Traeger approach helps release deep-seated physical and mental patterns and facilitates deep relaxation, increased physical mobility, and mental clarity. The founder, Milton Traeger, called his work psychophysical integration. He was an athlete, dancer, and bodybuilder. He began doing bodywork with no training and later worked under a variety of practitioner licenses, including an MD earned in Mexico followed by 2 years residency in psychiatry. Traeger wanted Western medicine to appreciate the mind-body connection and healing challenging conditions such as post-polio, Parkinson's, and other neuromuscular conditions. Doctors referred patients to him and were pleased with the results. But the medical approach to these conditions did not fundamentally shift away from medication and surgery as he had envisioned. Late in life, at Esalen Institute, he was encouraged to begin teaching, which he did for the last 22 years of his life. At the beginning of a session, the practitioner enters into a state of meditation that Milton Traeger originally termed hookup. From this state of mind, the practitioner uses gentle touch and a combination of passive and active movement with the intent of teaching the recipient how to move with less effort. The contact is gentle in a sense. It may be quite firm but is without strain or resistance. Regarding pain, Traeger practitioners avoid causing pain, and attempt to contact the body in a way that allows the client to have decreased fear of pain and increased willingness to be present with the full range of sensations. Practitioners are taught to allow a tone of curiosity, playfulness, and effortlessness to guide their work. In addition to hands-on body work, clients are taught a series of movements called mentastics to be performed with a certain mental attention. While doing these movements, the client is asked to explore how to move with the least tension and effort possible.
So the next one is basically just going back to what the Traeger is. The Traeger approach is a form of somatic education. Proponents, which basically proponents is people who are for this, claim that Traeger approach helps release deep-seated physical and mental patterns and facilitates deep relaxation. And also increases physical mobility and increases mental clarity. The founder, Milton Traeger, called this work psychophysical integration or mentastics. He was an athlete, dancer, and bodybuilder. He began doing body work with no training and later worked under a variety of practitioner licenses, including an MD earned in Mexico, followed by 2 years residency in psychiatry. What is somatic education? You will hear that a lot with Traeger. Somatics is an educational process where you can learn the skills to self-heal your own body. The movements are gentle, therapeutic, and suitable for all ages and physical abilities. Somatic movement education can help with a variety of issues, including chronic back pain, neck, and shoulder pain. So I'm not quite sure if you guys have seen somatic re-education or education or even mentastics or Traeger, it is different. It's more of something that you tell your clients to go home and do. And the whole thing that Milton Traeger wanted to do eventually was to have a system of self-care that you won't need any type of, how do you call it, medical pills or something to that effect. Unfortunately, in the years to come, he found out that medicine is actually something that everybody needs. Like if you have cancer or something to that effect, this is not going to self-heal you. So he was kind of sad to learn this, but at the same time, Traeger can be used, and I have been using it more as an assessment tool. Let's see here. So what is clinical somatic education? So clinical somatic education, or CSE, is a method of teachings you or your clients learn how to release chronic muscle contraction and improve posture and movement to try to get out of pain and stop doing damage to the body. Clinical somatics restrains the nervous system to release involuntary muscle tension and relieve pain by retraining damaging posture and movement patterns. So for instance, if you feel angry or something like that, you have this tendency of tightening your shoulder, tightening your arms, ready to fight or flight. And so you teach your body to do this without thinking. So what CSE does is it teaches you to relearn things. So when you actually feel angry, you're not tensing up, hopefully. But that's very difficult because that's an emotional response. And hopefully some of the things that you're doing has no attachment to an emotion so that you can retrain yourself a little bit better. So what does a Traeger session look like? During a Traeger session, the client remains clothed. So no need for taking off any clothing. There's some people who want to take off clothing because they feel better without the restriction of clothes. So depending upon the area being treated, the client might wear a swimwear, but loose-fitting clothing is generally advised, and sessions may last from an hour to an hour and a half. No lotions or oil are used in this form of therapy. So if you have a client who does not want to take off their clothing, hopefully they're not wearing tight pants or, tight jeans, then Traeger is something that you may be able to use. It saves on lotion and oil. You don't have to use any of them. So it's something that a lot of massage therapists, after coming from massage school and they're newly licensed, when a client doesn't want to take off their clothes and get on the table, the students or the newly licensed therapists don't know what to do. So Traeger is something that you can also do when people remain clothed on your table. So here is a video of what that looks like. All right, so that's basically what Traeger looks like, and parang niyuyug-yug yung tao. You kind of rock them, right? You rock them back and forth, and so that's kind of like what Traeger is, trying to find that feeling of safety.
So Traeger involves a lot of vibration techniques, jostling, rocking.
Correct. And a lot of compression too. There's compression and a little bit of friction involved in there, all at the same time. So the whole idea of Traeger is basically this. Okay, I know everybody has gone through this experience in which they're like this, like oh, I'm tense, and you go and then you do that. That is Traeger. You probably already have done that and not know that that is what Milton Traeger has developed. And when I was watching some of his Mentastic videos, it looks really weird. So it almost looked like they were in a trance. So they would stand up or sit or whatever, and they would actually rock back and forth, and you go freer than that. What feels? Where do you go that frees all the muscles? So that is what I thought was weird when I was in school. But when I think about it, everybody does it, but they don't say freer than that. They just kind of do this. Like, so you have a stiff neck and you're just going to do this, right? You're going to try to find all the range of motion that it can work, and then hopefully it loosens up. So this is the same thing. You shoulder, you go through the whole range of motion, and you say, okay, there's a restriction there, so I find a less restriction this way, and then do it that way. And the next thing you know, you have good synovial fluid in your joints, and then you actually start moving a little bit better. So that is what Traeger is. It will look funny when you're doing it, and that's exactly what you teach your clients. It's more of an education for the clients, and then you apply it by doing a lot of shaking and mobilizing the joints. That's all basically what Traeger is the jostling, the compression, and a little bit of friction. As you can see that he was pinching the skin and then shaking. I actually use Traeger a little bit when uh, guarding mechanism starts happening, when I put a little too much pressure on a client and then they guard, and then that's when I do a little bit of shaking. And then that seems to let things go. And plus, backing off a little bit and then just doing the shaking. So, Marianne here, my wife, will be the demo,
Okay.
but she just ate.
I just ate. I told her I just ate. Don't too much.
Oh boy. Tapos yuyog-yug pa. Uh-oh, we're in trouble.
Because we just got done at work.
Yeah,
So
we got home at 7 o'clock, and the whole thing starts at 7:30.
she said, "Hurry up to do soap chart because I have a meeting."
So let's show you what I do as an assessment, beginning and usually the ending of a massage. So Marianne will stay clothed, and she's going to go face down first, and it's very simple is what I try to do. And this is something that I actually showed a little bit after the pioneer class of the preventing disease transmission in a massage practice got done, and I showed them about 15-20 minutes of this. But now I'm going to do a little bit more because 30 minutes is pretty much a good portion of time.
30 minutes face down only, or
No,
the whole thing?
You're gonna be face down and face up.
Face down and face up. Okay.
Face down or face up. Face down first,
Okay.
because most of the clients are usually face down. So I don't know if you guys use bolsters, but I'm gonna use a bolster on her. When she's face up, I'll probably won't use a bolster. So I learned a little bit more of the Traeger.
Since wala namang bolster sa Pilipinas, huwag ka na lang kayo maglagay ng bolster.
Well, they use like pillows. That's a bolster. That's basically what a bolster is a pillow, except ours is cylindrical. And the reason why I prefer using a bolster is because when you bend the knees, it loosens up the pull of the hamstring on the pelvic,
Right.
the sits bone. Because if it doesn't, if it stays straight like this, straight like this actually pulls on the pelvis, rotating it backwards. So if I keep this, the knees slightly bent, it should not pull on the low back. It actually will give it some slack. So I usually start on the sacrum, and I just basically do a circular motion, but I push more this way. Have you pushed someone on a swing? So when they're swinging, you push on the way down, right? You push on the way down. If you push here, then you're gonna hit each other, and you're actually gonna kill the momentum. So you push on the way down, like that. So that's basically what I'm trying to do on her way back to there. See how it's moving back and forth for a little bit? So as she comes back there, just to show you, but you're not supposed to let go. You have continuous touch or contact. So I am just looking to see where things are moving, and also feeling to see how loose that whole thing is. So now we're using Trager more as a assessment tool. So she's moving pretty good. She's pretty loose. And then I'm going to go on the opposite side of the spine, creating a little bit more of a massage compression.
Explain to them that you are on top of pressure.
Yep. This is the joint, the lumbosacral joint. So I'm again doing this kind of thing, and the push is more going towards away from me.
On top of the sacrum.
No, I'm on the lumbar sacrum. So going up slightly with the heel of your hand on the lamina groove. And then here we go. We are actually going further away from the glutes, right? From the sacrum. But look how much her glutes are moving, and I'm already on the lumbar. So that means she is actually doing well, because as I push, there's a little bit of a delay. So she has good flexible spine, the muscles on the spine. Here's the thing, if people are really stiff, this whole thing is stiff, then they would roll at the same time like a log or a stick. So, but hers, see, there's a little bit of a delay. There's going to be more of a delay when I get further up the thoracic. So now I'm on the thoracic lumbar area. And see now, there's a little bit more of a delay. So she's not that stiff on the spine. A lot of people are stiff on the mid area, the mid back. As you can see, it's not moving as much. And then a little stiff here too. And then we're going to go on the upper thoracic. And not so much now on there. But I can, if I wanted to, make that whole thing move. So it's really more this way now rather than the circular motion. So the assessment that I have is actually I need to work more in the mid-back. But at the same time, I'm going to do the jostling so that as the joints on the spine articulates, the vertebra articulates with each other, it actually creates a little bit of heat and hopefully synovial fluid, making this whole thing move smoothly. So now I'm going to do the same thing on the other side. Wala ako sa bone. I just said 11. And do be careful of the transverse process and the spinous process. Sometimes when I do this, there's a little bit of a popping on the spine because of they're loosening up. But I'm not trying to pop the spine.
It's Papa. Oh,
Yeah,
stop.
there's another one. So I am not trying to do any chiropractic adjustment. I'm just stretching the vertebrae that way, and if they articulate, if they move and pop out of the way, then great, freebie. When that happens, I say free adjustment. All right, and then so we're going to get on the glutes. We're doing the same thing. We're pushing it that way. So the whole thing, we're trying to move and jostle, still the hip and also the leg. The femur in the hip socket will now get a nice jostling and hopefully loosening up any type of restriction. So Marianne doesn't have a lot of restrictions, but I do know she does have a restriction. Which shoulder was it? This side?
The right side.
The right side. So on the hamstring, doing the same thing. We're pushing that way, right? And I'm using a soft fist. Soft fist. So now this one, I'm also doing a kind of rolling action, but pinching. And if I want to, now the ankles is that. That'll get the ankles going. So if there's any restriction, you will find out on how the ankle's moving. There is no restriction on her ankles, at least this ankle. All right, doing the same thing on the other side. To tell you the truth, when I do a massage, everything that I've learned comes in, even Thai massage comes in. Okay. So on the arm, Marianne's arm is actually the problem side is on that right side. But I'll show you some stuff that you can actually do. I mean, this is something that you can do just to see if the arm is actually nice and loose. If she's going to guard, you will know it. And you can't see it on the other side. She will guard because she has injured it before when she was trying to do some pulling and stretching with a band that was too strong for her. She thought she can do it and she overdid it. So anything like this, just trying to see where everything is, if it's anything restricted. So there's no really right or wrong way to do it. The only thing that I can say that is wrong, if you're trying to do something where her arm cannot go, and then you're forcing it to go, where it's not supposed to go. Again, the whole thing is to free a joint. If it doesn't want to go that way, then don't go there. Doesn't want to go this way, then don't go there. But see how things are? That's basically what Trager is. Elbow needs to loosen up, shoulder needs to loosen up, wrist needs to loosen up, except you can't see the wrist because there you go. But this is not a good portion. So on the legs, I'm also doing the same thing, but now I'm kind of going back and forth with this. The whole idea is to, again, articulate that hip joint and then see how her whole body goes with it. So I'm actually passing it along back and forth. And then if you want to create a massage with the Trager, you basically include a little bit of traction, shaking, and compression. So on this particular hip and knee, it feels like it's very relaxed. And then we're just gonna make sure that it stays like that. Taking it to some range of motion. So I am guiding it with my hand underneath the knee. Do not try to use the same thing doing this way unless they're not very flexible and very relaxed. Then you can definitely do it this way. But Marianne is so flexible that I don't want to over exaggerate basically her movement. So I'm doing this. The other reason why I also have my hand underneath her knee is because if it ever falls down here and there's no bolster to catch, I do not hyperextend that knee. That would be something bad. So I guide it with this. So it doesn't hyperextend. This can easily hyperextend that knee if I basically raise this hand up. And that's not what we want to do. We want to make sure that we're just moving the joint to loosen it up. And do the same thing to the other side. There's another one that you can use. I'm not sure if you can see this. So you can also use that on the hand. You're putting the base part of your palm near the wrist area. This is something, oh, it crackled. Something like that. Not a lot of people like this. So, let's see here. So, that's something that you can do on the wrist, on the ankle, your side to side. So you're going to be inferior to the malleolus on both sides, the medial and lateral malleolus. Not a lot of people like this. I don't.
I like it.
You like it?
Yeah.
Okay. That'll get the ankle going. Loosen up.
Just being a massage therapist, we're always standing.
Yeah, but mine is more my calf and forearm. So on the feet, you actually want to mobilize it by going back and forth, trying to...
Metatarsal?
Yeah, the meta?
Metatarsal.
Yeah, tarsals, yes, metatarsals. So here, I'm just making sure I'm also articulating and moving the joints and moving each metatarsals away from each other. So you're doing this kind of thing. I'm not quite sure if you can see it from over there. And then, just like what you do with the hands, you're trying to spread them apart. So things that you can do without lotion. As you can see, my table is very low. I tend to do a lot of kneeling. And you can do this as fast as you want, but the faster it is, the more irritating it is to the client. So you want to go as fast as what the ankle can do. You can go slow, but it kind of defeats the purpose sometimes. Fast enough so that you can actually move that ankle a little bit better without losing it. So now I'm going to
Show
move.
the eversion and inversion too.
Don't worry about it. It's kind of like we're doing eversion and inversion at the same time. So you're doing a ringing. So you're ringing. The whole idea is to move the joints away from each other and stretch them. You can do it in this position, or you can stand up and do it in this position. So you're doing a popsicle. You know how you break a popsicle? So on the arm, I actually will do it this way to see where she is able to move and where she starts guarding. This one I'm actually doing a lot of kneading. I'm pushing it back into the joint, kneading and pulling it back and then pushing it back in. So the joint is actually doing kind of this motion and hopefully trying to get some synovial fluid in there. And at the same time massaging the deltoids because it's pretty tight up here. But this is not the injured side. As you can see, she's not at all tightening up. She's not at all going against me or guarding. Has anybody actually done a little bit of Traeger that they didn't even know that they were doing Traeger? So I'm doing the
I
same thing
do.
with the feet.
So this is a lot of people like it to pop
Knuckles.
the knuckles of the carpal bone.
Yeah.
So a
The,
lot
the
of
one,
people like it.
Lynn, the one that you said that was irritating. A lot of our clients here actually like it. The one on
Really?
the ankle. Yeah. So I was surprised that you said that your clients are irritated by it. It really feels good if it's lubricated, but I know it's Traeger. But well, personally, I also like it. A lot of my clients like it.
Okay, probably the reason why I don't like it is I have hypermobile ankles. If they do it fast enough, my my tarsal bones get off and then I won't be able to walk on my feet because it actually moves so much that it's going to go out of alignment and I can't walk on it. And that's probably why I don't like it.
So the reason why you need to assessment first, at least you know.
You
If,
have no idea how many times I told students that at
okay.
RTC, and then they still do that, and I'm going, oh, hold on, I can't walk now. So that's the reason why I don't like it, personally. But I like it on my hands, my carpals. It's a lot better, but it slaps therapist, and a lot of people don't like that sound.
For me,
slapping.
because I don't have a problem, I like it. For her, she didn't like it because she is hypermobile.
Okay. So this actually feels really good. Now you're going to watch that side. It's going to be a little different. She's going to guard. Oh, there's that elbow. It's not bending.
Because I start feel my tricep.
Yep. We need to see. It's not. Let go of the elbow. Let go of the elbow. Let it go. So now what she's doing is she's actually extending that tricep. And I need for her to stop doing that. I thought it would be up here, but she's actually guarding with her triceps. There we go. So for her, what I'm going to do, there you go, is I'm going to see if I can work on that tricep. You cannot see me. Okay. So I am going to use a little bit of deep transverse friction to loosen up.
Because that is my problem.
This is the one that guards a lot. Hopefully the Trager with the deep transverse friction, it's fast enough to confuse the muscle from acting out. Oh, there you go. Okay, hold on. See, she's guarding. Hold on, let go. Drop. Right there. Is that better?
Oh, yeah.
Okay. There it is. So now I'm doing cross fiber friction, a little bit on the fast side on her deltoids because she's also guarding there. So the same thing what I did on that side, well, I push and then pull with the squeezing of the deltoid. The thing is in this one, I have to go slower and smaller increments.
It's a slower traction.
She is guarding on the front side, the anterior deltoid. See, right here is what I use. So I'm doing direct pressure and I'm using Trager to let her let go of that shoulder if she can. And so this is what I'm saying is that I didn't even know I was using Trager until I really looked into what I was doing. So I do this before and after, and sometimes during my massages, just to get her to loosen up. There we go. It's starting to loosen
So
up.
explain to them what you are doing, because this is my injured part. So while Lynn's doing is, she hold my
I'm doing the direct pressure on your deltoid.
She hold my one of the origin part of my deltoid that right now is triggered. While she will hold, and then she tried to traction. She tried jostling this one to
confuse the muscle
and also to loose.
Wow, it gets hot underneath the lights.
Excuse me.
Yes.
I heard traction. Wasn't it traction? You're doing traction?
No traction. She keeps thinking I'm tractioning. I'm actually shaking, jostling.
I mentioned.
Oh, okay.
And also slowly traction if you want.
That's later. As soon as there you go. As soon as her muscle lets go, then I will do a little bit of traction because what we want to do is to make sure that we include a full range of motion. Right now she's guarding so much that it's pulling into the shoulder socket. So the whole idea is basically this is not pure Trager. I am now holding this pattern right here so that she will relax into it. And once she relaxes into it, I can do more stuff. Because right now she's guarding.
Yeah, thank you.
Yep. So now I'm tractioning. I'm actually squeezing her deltoids from the middle to the anterior deltoid. And then tractioning slightly. I'm just leaning back a little bit. My knee is right here where my hand is, so I don't use my arms to pull. I'm using basically body mechanics. I'm sitting on my other leg. And this is the reason why I like my low table. I can sit on it, I can get on top of it without having to climb. So, and some of these is a waiting game. You just wait until it actually releases. And she's not releasing as fast as I would like, so I'm going to do a little bit more Trager and jostle. Find another spot that's a little bit more tight on the deltoid. It's a little bit more anterior and posterior deltoids. Shaking until, there we go. And then I'll traction a little bit. And then all they have to do is just breathe through the traction. And if the pain subsides, then we have actually re-educated those muscles to be this long and be able to, there it goes, it's starting to release.
It's starting to release.
Yep. And you don't want to speed the release. If you speed things up, it thinks you are trying to traumatize the area. So the front, the anterior deltoid actually is releasing faster than the backside. Most likely because she's still holding on to, there you go. That's why. She was tightening up and trying to extend that elbow. There it is, okay.
So if the client is muscle gardening that they did not know, ask to breathe.
Yep. Take nice deep breath and then have them release. And then I usually do a little bit more jostling to kind of put the attention on the shoulder and see if they'll let go. And she has. It's more let go on the anterior deltoid than it is on the posterior deltoid. But I have to be sure I can actually release the whole deltoid because most of our problem is on the tricep. So if I can get that tricep to let go, she should be able to move the shoulder with little to no pain. The problem is that you can get them to a point that they are feeling better, but it's also psychosomatic. They think it's still injured, so they still guard. So this is why I tell Marianne on, what she needs to do is to actually slowly move her arm to a point below pain threshold to get it going. And if that is too much, then I usually have her hanging the arm and just do pendulum. And that's all you need to do to get the shoulders to start moving. And then this is where the Mentastic comes in, and then kind of start adding a little bit more movement so that it gets used to it, because this is not your usual movement, right? You actually use your triceps and your bicep and so on and so forth. So she needs to start moving that to re-educate that shoulder that's okay to move. So now I'm feeling her shoulder, oh, I moved a little bit past what she's used to, and so she guarded. Okay. So palpation skill is something that you guys need to also work towards. There you go. There. Let it go. We're going to move slowly because breathe. Exhale. And just drop that shoulder for me. Drop, drop. So you don't want to make any sudden movement. So she's trying to extend that elbow again. So it's not the deltoids now, it's that tricep. And then when it comes to the neck, the problem with that one, you want to go too fast because baka mahilo yung tao eh. So what I usually do with the neck is more like this kind of deal. I'm just pushing up, right?
Every C1, C2, C3, C4.
Yep. On the lamina groove, on the side between the spinous processes and the transfer processes. And a little bit of traction. using the occiput. And then on the shoulder, you can pump alternate pumping, or you can actually do at the same time. But alternating is actually a little bit better. All right, for those of you who can do this and feel confident, then you can put a palm on the chest. Make sure that your index finger is close to where the clavicle, thank you, the clavicle is, because anything more than that, you're probably in the breast area. Now, if you have big hands, then you might want to just stay back a little bit and have maybe your middle finger near the clavicle. But for me, I don't have that big of a hand. And then what I also do with the neck is I also do a little bit like pumping, but more on the pulling. But I have to go slow. You don't want to do any sudden movement, so I do some traction.
So if you pull like that, all the spine
will straighten out, hopefully, and you'll get a crack somewhere, but you're not pulling that hard.
I feel the spine.
You do? Okay. So I don't know if you can see this. I am not doing any type of arm movement, right? You saw me rocking back and forth, back and forth. And that's kind of like the proper band mechanics. I sit a little bit, use my body weight to pull, stand up, sit a little bit, use my body to pull, stand up, okay? So another thing that I do at the end is I don't necessarily have them crack them, but I do tend to stretch them.
But sometimes it's cracked.
Yep, sometimes it does crack. It's a nice stretch and also a nice massage. That was me cracking.
So that technique, no need clients to help. Like, sometimes may client kasi na tumutulong, so hindi kailangan tumulong. Kasi pag tumulong, maaaring mag-spasm. So kailangan let go lang ang muscle.
Alright, thank you. Was that a good?
So yung 1 hour, inaano namin na like blood flow lang. Yung iba, hindi namin kailangan mag-focus ng matagal. Kasi 1 hour time is very important dito. So kung saan yung pinakang problem, nagbibigay sila ng tatlong problem. Minsan isa lang ang binibigay nilang problem. Tapos
Area, problem areas.
Problem area. Pero minsan pag na-feel namin na masyado talagang malala, siyempre hindi mo kakayanin ng ng isang oras. Hindi yan mapifix ng isang session lang eh. Pero kung ano yung pinaka-important, sasabihin nila kung doon sa tatlo, ano yung pinaka-malala. So, doon mo i-focus, halimbawa isang oras, doon ka magbigay ng more time. Halimbawa,
30 minutes, 40 minutes.
Halimbawa, 20 sa pinakang malala, then 10, eh di ba may matitira pang 20, yung 20 minutes, the whole area na hindi malala, kumbaga blood flow. So, ganun ang ginagawa namin. Pero kailangan, kung usually sa isang oras, ang dami naming technique na ginagawa. Kaya being a massage therapist, tatayo na ako, pwede ba
Yes,
ako tumayo?
yeah. Not too fast. Not too fast. Not too fast.
So, being a massage therapist, kailangan talaga marami kayong nalalaman. Kasi yung tinuturo ni Lynn, usually, ano lang namin yan, Opening.
Yeah, opening and
Opening lang
closing.
namin yan. Tapos, depende sa closing. So, being a massage therapist, pag may nalalaman kayo, dapat i-share ko lang yung nalalaman ko. So, ako kasi, pag nag-massage, katulad ng client ko kanina, napakatagal na niyang problem ang glutes niya. Ngayon, hindi ko akalain na siya pala ay naka-jeans kasi pumapasok kami na naka-cover na sila eh. Tapos nung i-work ko na yung glutes niya, kasi gusto ko kasi pag nag-work ako, skin to skin. Ngayon, i-work ko na yung glutes niya, naka-jeans pala. Yung sock na ano. So sabi ko, hindi ko mawa-work. Ngayon, ang ginawa ko, sports massage. Pero, tinarget ko yung problem ng glutes. Ano na ba yung mga glutes? So, pag may mga, kasi alam nyo din being a licensed massage therapist, syempre alam natin yung mga parts ng glutes. So, pinalpate ko muna, then, yun, in-stretch ko. So, ang sinishare ko lang, kailangan being a massage therapist, talagang marami talaga kayong nalalaman na technique. Para hindi yung isa lang. Kasi pagka, hindi nyo alam kung anong gagawin nyo pagka, may suot pala siya. Ay prepared ko, wala siyang suot. Kasi, nakapanty lang, nakaprep lang, yun lang ang prepared ko. Paano, may damit pala siya. So, hindi ko, yung nasa sa isip ko na dapat na gagawin ko,
Hindi mo
iba.
Yeah.
Kasi may suot pala siya, so kailangan meron kayong additional alternative na nalalaman para matulungan yung tao. So, yeah, pag sa session, minsan sa isang oras lang, ang dami kong ginagawang technique. Depende sa problem ng client. Diba, may dalawa tayong therapist.
This is now Q&A.
Dalawa kami therapist. Pwede
Sa amin yan, hindi daw siya magsasalita.
Okay, mahilig.
Be careful. So, is there any questions so far? I am not certified in Trager, but I use Trager methods to use as assessment, beginning and ending of my sessions, and I also use it throughout my massage session. As you can see, I was holding on her shoulder while I was rocking and jostling the elbow. Nope, no question.
No question. Just wanted to share an experience because usually, when you do the hold and the whole thing, right, because people here in the Philippines, they think that you're not doing anything, and it took me a lot of time to remove that from my mindset. Because if you don't continuously move when you do your massage, your client would think na, ay, ano ba, wala siyang ginagawa.
No.
And that's very important na there's communication between you and the client. So I have learned na to talk to the client. Okay, I'm holding this, and you breathe with me, and it makes it more relevant for the clients. Kasi as compared to before, pag kinuhold mo lang tapos it's just like dead air. Your client would feel na wala kang ginagawa. Ano ba yan? Pinipindot lang naman yung muscle ko. It's very important then when you do those things na you communicate with your client, they're aware, and it makes the session relevant for them. And since Trager is a psycho mechanical approach, this is one thing na interesado ako. Because I think we all started from a biomechanical approach na ito yung muscle, ito lang yung muscle na gagawin para, gumaling, whatever. For a lot of studies are coming out na there's a very big factor yung social, psychological, aside from the physical thing. And this is one of the growing schools of thought sa massage, itong psychosocial model, which I find interesting. That's the reason why when I read about the background on Trager, last minute ako nag-register. Because I'm very interested in that. Nakahabol ako eh. So I'm very interested, and I hope na my fellow massage therapists also in the Philippines would start exploring this other school of thoughts. Kasi parang tama ka, we're so focused on a technique. We usually just name them like this is a Swedish session, this is a shiatsu session, this is a Thai session, and though I see a lot of therapists din naman who are using a mix of all the techniques that they have been learning through their seminars or through their education, and that's good. And yeah, and hopefully nga, yun lang yung kwan na hopefully na as a yung sa massage therapists in the Philippines would eventually explore these other schools of thoughts. Kasi parang we have been stuck in that era na we're just used to one technique na ganyan. And yeah, and I sa psychological part, Trager is not new to me. I the concept rather, or the somatic movement, because I have been a dancer before. So we use it all, and I'm also a psych graduate. So sometimes we use movement therapy. And when you were talking kanina, it suddenly dawned into me na, yeah, you could use this pala in massage. So that was a very interesting insight. Because,
Usually, simpleng movement lang yung ginawa ni Lynn.
Yeah.
Pero
yeah,
ito i-feedback ko being a receiver, na-feel ko na nag-loosen.
yeah,
Nag-loosen yung
yeah,
kasi yung joint capsule, kasi joint, nag-aano din yung joint capsule dyan eh. Kapag inaano mo yung mismong sa loob ng bone, na nalulusen din. Kaya ang nangyari tuloy, ano siya, nag-loosen. Usually, jostling parang yun, wala pa yung work doon na talagang focus na work. Pero na-feel ko na yung loosen niya. So,
yeah, and siguro part when we also use the techniques kasi a lot of the clients here, hindi sila sanay sa mga bagong ganyan. Especially
ng mga Pilipino kasi, ang gusto kasi ng mga
Oo,
Pilipino, target ka agad sa,
yun.
medyo
Yeah.
complain ka. Kasi hindi nga, kaya kailangan being a massage therapist, marunong din tayo mag-explain.
Ayun,
Also,
kailangan
another thing that I
communication.
think what needs to happen is for massage therapists in the Philippines to educate their clients. Kasi itong nakikita ko, it's their clients saying, this is what I want, this is what I want,
Kasi-
this is what I want. You're not a massage therapist. I am. So I think this is what needs to happen. And you need to come back next week so we can work on that.
Usually, ang mga client dito hindi na nanalo sa amin. Kapag sinabi nilang i-dip mo, hindi na, pag alam namin hindi pwedeng i-dip, hindi namin i-dip. Kasi may mga client din kami na gusto dip na dip. Ngayon, susubukan namin, pero pag na-feel namin na yung muscle
Umiilag sila.
lumalaban sa
Yeah.
amin,
Right.
namin, i-work pa rin namin. Pero pag talagang hindi kaya, na-feel namin yung muscle masyadong mainit, tapos kasi ramdam namin pag tender, swollen, tight, ramdam namin yung difference ng muscle. So, pag na-feel namin na, hindi namin pwedeng i-dip sa dip na gusto nila. Kasi, ang tendency, magbubrush yan. Or either that, magsosore yan ng 1 week. Ayaw namin mangyari yun. Pwede magsore hanggang 2 days lang. Pero pag more than 2 days, ayaw namin na mangyari yun. So, pag ganoon, pinapaliwanagan namin ang client na ito ang mangyayari kapag ginawa ko yung gusto mo. So, dahil being a massage therapist, alam ko kung anong ginagawa ko. So, let's say ganito na lang gawin natin. So, instead of i-dip ko ng 2 months, minsan kasi meron kaming sa office namin na meron kaming cold pack, hot pack, kung anong kailangan ng muscle. So, after namin i-work, dahil gusto niya ng dip, let's say, put muna tayo ng, halimbawa, cold pack.
Okay.
Cold pack. So, yun. Then, papaliwanagan ko. Bumalik, sa next time na lang pagka, pero babalikan ko pa rin yun. Titignan ko kung kaya ko pa rin i-dip. Pero pag sa pangalawang pagbalik ko at hindi pa rin kaya, yun, magdidesisyon na kung hindi ko kaya i-dip. Hindi pa natin pwedeng i-dip. Hindi natin pwedeng biglain ang muscle. Kasi ang mga Pilipino kasi nangyayari, pag masakit, gusto, dahil nagbabayad sila, gusto parang masolve yung
silang
binabayad ko na mas talagang gusto kong maramdaman na kaagad. Pag pinilit mo yun, baka ang tendency, may matamaan ka pang mga hindi dapat, mga nerve, ng mga, kung ano mga dapat, yun pala, hindi mo alam, swollen pala, na-dip mo. Hindi, usually, pag inflammation yan, hindi yan dapat dinitip.
Yeah.
So, paano being a therapist, hindi mo pala alam, dinip mo, ginusto ng client, idip mo, swollen pala, ma-injured yan.
The thing is that we're getting into the heart of it, that most massage therapists do not know how to assess, do not know how to treat, and do not know how to evaluate. So they basically come with a client that says, this is what's wrong with me. Kahit na sinabi mo, was that a diagnosis from a doctor, or are you coming up with that diagnosis? And you have to be a little bit more adamant that, okay, I'm the therapist. I think this is what's happening from what you're showing me and what you're telling me. Then I think this is what we need to do, and then come back later to see if it worked or not worked. But we don't want to overdo it. Wag bastang biglain na hilain because yun ang gusto nila. Kasi kung hilain mo tapos yung pala something goes wrong, sinong sasagot nun? Alam mo naman dyan sa Pilipinas, pag meron kang masamang ginawa sa kanila, all of a sudden, sisirain ka. So, most of the therapists dyan sa Pilipinas is, careful, wag. O you're not being a therapist. So,
Yeah.
hindi dapat ganyan.
Yeah. Mostly kasi sa Philippines, tinuturo doon, lagi yung relaxation. The institution starts with relaxation. So, kung ano yung sinasabi ng mga kliyente na gusto ko ng deep, gusto ko ng ganito, gusto ko ng moderate, yun ay bibigay mo. We're not actually communicating with the client itself, but the muscle itself, but
Correct.
the anatomy itself. So, you have to do is to communicate yung laman o yung muscle which your hands really been feeling. So, regardless kung ano yung sinasabi ng kliyente mismo na mukha niya mismo, you need to feel kung ano yung sinasabi din ng muscle niya. Otherwise, there would be a very big disadvantage after ng kanyang after na session niya. Kasi after a day of 48 hours, pwede kanyang balikan, I have big something in my shoulder. So, pwede mo ba i-fix yun? Pwede natin sabihin, that's the cause of your request. Hindi mo pwede sisihin siya. Hindi
Yeah.
siya pwede sisihin. Pinadip mo ako eh. Gusto mo, di-dip kita. Very compromising if you just simply follow kung ano yung request ng mismong tao. But what is the real request is yung request mismo ng laman.
Kasi katulad yan, pag nag-complain ng client, na masakit ito kung sinunod mo na kaya tama na yung sinabi mo na kung ano yung sinasabi ng muscle. Kasi wag mo susundin yung client. Kasi ikaw yung may nalalaman, ikaw yung may knowledge. Kapag pag sinunod mo yung client, alam mo ako client, sakit ito, idiin mo lang, sige pa. And then all of a sudden, biglang sore, yung iba hindi na makalakad sa sobrang sakit. Tapos ikaw ang sisisihin.
Yep.
Kasi ginawa mo Ikaw itong lisensyado. Kaya dapat ang masusunod ikaw.
Pag ayaw nila, they can go someplace else. The problem is, if you already
as,
have
as soon as possible, ipaliwanagan mo para sa'yo
well,
pa rin
it's the
mapunta.
education portion. Ito ang gusto ko mangyari din. Kailangan yung mga kliyente is also educated. So, I think, ito ang feelings ko at saka I believe that massage therapists should do some sort of education. So once a week, maybe have a free 1 hour education, even on social media. So we'll see you guys. I'm gonna end the session, and you guys have a great afternoon. Kasi gabi na dito.
Thank you.
Thank you. Thank you. Bye-bye.
Bye.